And now we're going to talk to Dr. Harrington of Routt County. Hey, doctor, how you doing?
Hello, great.
Hey, crazy week this week, huh?
Well, yes, certainly in the COVID world locally, we had gone quite a ways without any positive cases in the general community. We had our outbreak of cases pawned, so I had a few extra cases came up with that. But basically from April 30th until June 8th, we had not had a positive case in our greater community. Then we had an asymptomatic individual test positive who was being screened for a procedure. And then after that, we've then had a handful of other cases in our community here just in the past week. We're currently investigating each of those and kind of tracing out circles of contacts. We very well may find even additional cases related to that.
Yeah, it felt like such positive news, not having those cases, and I know we were all stoked and kind of opening up the community again. And do you think that could be some of the cause of these new cases, or had they been here and just are now being seen?
Right, and I understand that that is a concern, but as we know with a couple of these cases, at least, if not maybe another one of them, it involved people from outside of or people traveling outside of our community. For example, somebody leaves our area, goes to another state, and in particular states where maybe they have rising numbers of cases, and participate in gatherings there of large groups of people, and then return here. So people sometimes get the fear that it's people who don't live here coming and bringing it in, but equally a risk factor is when we go to other places and then might contract the virus and bring it back here.
Yeah, that definitely makes sense. It's a lot of unknowns, but it seems to be panning out that way. Well, how has opening been going just in general?
Well, good. I mean, we tried to set down some what we would say helpful guidelines so that when businesses open up, they can do it safely. And I think the businesses have been working hard. I know we've had a lot of help with the Chamber of Commerce and other business entities in town, owners. And, in general, people are trying to do the right thing. We know that we can't be perfect. We can't always say what matters the most, but we do think that in collective, the actions that people are taking can help reduce the spread of disease, which is important for this whole idea of opening, right? Because there's no promise that we couldn't go back to last spring in terms of the caseload and the risk to people. And it's not a guarantee that once we open things up, we wouldn't have to retrench somewhat. So it is important that we all do our best to kind of limit the spread of the disease, both because of its health impact and because it probably has some consequences then for the opening of our society. Things are different, though, than they were back in March and April, as a positive note. I would point out that now that we have much more robust testing capacity, we've got our contact tracing team working hard, and we understand more about the disease. So I would say that the situation is different from what it was last spring in terms of our ability to deal with it. Although I would also emphasize that our community is just as susceptible to it now as we were back in March.
Yeah, it's so interesting. You said you were talking about contact tracing. What's that process entail? Like, do you talk to people who have it, and then like the 500 people you could have contacted with?
Right. So when we have a positive case, we have a team of nurses and they follow certain guidelines set down by the CDC and the Colorado Department of Public Health. And they have a template of questions they ask and things that they say. But they contact the positive case and they kind of do a history going back many days, weeks even, of their activities and who they've been in contact, what type of contact. Then if somebody is defined as a close contact, which has to do with being together within a 6 feet parameter for, say, 15 minutes and some other things, they get defined as a formal close contact. We actually give them quarantine orders. But beyond that, we also then try to identify anybody who may have had contact with the patient, even if it doesn't meet that strict definition of close contact. And so they may not require a quarantine order, but we encourage anybody who thinks they may have had contact with a case to go ahead and get tested in our community. And these processes, so for example, one of our recent cases, a person, we were actually notified by a public health department in another state. They had a positive case. And in conversations with that case, they found out that among the people that may have had close contact was a resident of our county. And so they contacted our public health department. Our contact tracing team then contacted this individual. We had them in quarantine. We tested them, and then they tested positive. So we then did a full contact tracing survey of that person. And it's kind of like a circle. And we keep making extra layers of the circle. And when we find a case in the next layer, then we move our layer out even one further for the testing parameters.
To say that is thorough is an understatement. That sounds great. In wrapping things up, Dr. Harrington, what is the next step for the community? And part two of that question is, what can we continue to do, and or new things can we do to help this effort and moving beyond this?
Yeah, I would say, I mean, two of the next things in my mind that are being actually worked on. One is we've submitted variances. Carol Ledrow, the public health director, has submitted variance requests with the state. So there's a process where if we feel that we can justify it, we can ask for looser restrictions than what the state has laid out. And leading up to this previous week, we actually thought we were in an excellent position for that. And so we did submit some variance requests allowing us to have larger group sizes here in our community, both indoors and outdoors. I will comment that with those variance requests, the state does look at whether you have a stable or declining case count. And it's possible they may look at our increasing cases here and feel that we're not in a position to be given a variance. I'm not going to predict that, but that is a possibility, unfortunately. Then another big thing going on now, I know, is that all the different schools in our communities, in our county, are actively working on how they can safely and successfully open school, which will occur here in just a couple months. And that's a big thing to plan. It's important because the kids need to be back in school. It's important because a lot of families literally count on their kids being in school during the work days. But it's important also because we know that schools tend to be one of the main reservoirs of illness in any community. And we always see in the fall with weather changes and people being indoors and school beginning is when we start to see kind of the cold and flu season begin. And so it will probably also herald the rise of, again, more COVID infections.
Yeah, I understand that. My wife is a 5th grade teacher over at Strawberry Park Elementary School, so I'm very aware of the that can be. Well, Dr. Harrington, thank you so much for joining us this morning and updating the community. I really hope that we can touch base with you again soon. And as things are unfolding, keep on getting more and more updates from you. I appreciate your time.
Well, happy to do so. Our community's been working hard over the summer, and I applaud everybody's efforts. And it's not over, unfortunately. We've all got to keep at it and keep doing the measures that we think all help reduce the risk of spread of this disease, because it matters just for us, but it matters for all the people around us in our community.
Well, again, thank you so much. And everybody, stick around. We'll be right back after this break.